So if your client has an order for a blood draw on a central line, we can do that as long as we have the appropriate equipment in the home and a way to get the blood to the facility, to the laboratory for processing. If you need to do a blood draw, you'll want to first wash your hands. I just washed my hands. I'm going to gather my supplies. I need gloves, alcohol wipes. I need a sterile Luer lock syringe for collection. I need whatever appropriate lab tubes for the labs that are ordered. I need some type of transfer device to get the blood from the syringe into the tube in a sterile way. A couple of saline flushes and a heparin flush. Always following a lab or a blood draw from a central line, you want to change the cap. So I need to prepare a new cap after my draw is complete. So I'm going to prepare that cap. Open the package. I'm going to prime the new cap with saline. Inside of the package. And I'm going to set that down for when I'm ready to use it. All right. So I'm going to begin by scrubbing the cap. Use a saline syringe. And I'm going to flush the line. And then I'm going to remove a waste volume of blood. That may vary depending upon the recommendations for the test that you're doing, but typically the recommendation is 5 milliliters. So I'm going to withdraw 5 milliliters of blood. It's a little bit difficult to see with our mannequin. We got a few air bubbles, but 5 milliliters of blood. Okay, I would close the clamp then. Remove that syringe, and I want to place that into a biohazard container since there's blood in there. I'm going to scrub the cap again. Then I'm going to open my sterile syringe. Connect it to the cap, and then I'm going to remove the blood to fill my tube. And again, this varies depending upon the test that you're completing. Shouldn't be difficult to withdraw blood from the line. So you fill your syringe with the appropriate volume. Then I'm going to open up my transfer device. Connect it to the syringe. And connect it to the tube. These particular tubes are called vacutainers, and they will automatically fill from the syringe. When that's complete, I can remove the tube, set it aside. After I complete a blood draw, I need to change the cap on the line. At that point, depending upon what you're going to do with the line, if it's going to be left vacant and your client has orders for it, we would scrub the hub again and follow with a heparin flush. However, if you already have fluids running or if it's not appropriate for your client, after the saline flush, you'd be completed with this procedure. So you'd wash your hands, clean up your supplies, and document the blood draw. And then again, take care with the specimens to get them to the laboratory. Sometimes they need to be iced, sometimes they need to be protected from light. So again, follow the standards from the laboratory that your client is using.